Welcome, my name is Nasan, and today I'm here to talk about prostate cancer. And as we know, prostate cancer affects men, 100% men. And that's why I want to talk about it so that all men can know how it presents. We want to talk about early signs of prostate cancer and also what are some of the late signs of prostate cancer and predisposing factors, management, and some of the diagnostics that you need to go for investigation so that you can rule out if it is a cancer or it's not a cancer. Remember to subscribe to my channel. I've talked about other cancers like breast cancer, cervical cancer, and I'm intending to talk about more on this cancer so that our people can know what are some of the signs and how to go about it. And actually, as we know, prostate cancer is among the leading cancers in the world after skin cancer, and some of the early signs and symptoms actually look alike, like enlarged prostate or a urinary tract infection. Therefore, it confuses more people, thinking that it's just a simple thing, I'll just go for treatment. And even sometimes it confuses doctors and nurses to give actual diagnosis and early diagnosis. And that's why today I want to talk about it and bring to our attention that actually we need to go for tests. And the best thing is making sure that you do frequent self-examination or annual check for prostate. And as we know, prostate cancer is the cancer that affects the prostate. And some of the predisposing factors here include age. Mostly people who are aged from 35 years to 75 years are of high chances of getting this type of cancer, but mostly below 65 years. So if you are of this age, it's always good for you to consider doing some screening most of the time so that you can rule out. Also, there is what we call family history. If you have a family member who ever suffered from prostate cancer, it's good for you also to consider the same. We also have race. Prostate cancer affects mostly African American people compared to other races. It doesn't mean other races are not having prostate cancer. Of course they do, but if we go to percentage and how frequent are they affected, actually African American are the most people who are affected. And as I've always said, overweight is always a predisposing factor to most conditions. Therefore, let us come into our early signs of prostate cancer. And as I have already said, early signs mostly confuses with most signs of urinary tract infection and also enlarged prostate. And we have two types of cancer. This type of cancer we have slow growing and fast growing. Slow growing can stay there for decades without being noticed, and most of them will not need any aggressive treatment. But there are prostate cancer that they are very aggressive, and as they grow they increase in size, and therefore presses on the urethra that help us to pass urine, and therefore it presents like urinary tract infection. So what are some of these signs and symptoms for? Let us come into the early signs of prostate cancer. One of it is persistent back pain. I know most of us have back pain, but we have this persistent back pain. As a man, if you have this back pain that you have been treating but it's not going away, it is always good for you to seek for further investigation. Also, if you see blood or semen in urine, is not a good sign as a man, and it is always good for you to go for test to ensure that it is not something that is growing up. Also, we have this painful ejaculation. Anytime you are ejaculating, you have this very painful ejaculation. You consider it as a bad sign at this moment. Also, erectile dysfunction. Not only ejaculation problem, but you are also having erectile dysfunction. It is among the early signs of prostate cancer. Now, when it comes to urine, you start having burning sensation when you are passing urine. It's not a good sign. And also you have this delayed insertion of urine stream, and also problem emptying the bladder. If you have just emptied the bladder, but you feel like it is not fully emptied, or you are having frequent micturition, especially at night, is not a good sign. It's good for you to go to hospital to rule out other factors, like what I've said, like urinary tract infection. And if it's not there, it's always good to go for further investigation. Some people also experience dribbling of urine even after they have finished urination. You have just finished urination, but you are still having dribbling, or you are having increased frequency of urination. Frequency, just all the time you want to go to the urine. Let us also look into advanced sign of prostate cancer. These are some of the signs that usually come about when cancer has gone too far and it has gone to other organs or other systems, or what we call it has metastasized. And as we know, there are some systems and some things that actually are affected at this point because it has gone very far. These include very painful back pain, bone pain, or even pelvic pain. At this point, some patients cannot even respond to most painkillers, and therefore they are in a lot of pain. Also, the lymphatic system are affected, and therefore they start having swollen legs, or the lower limbs are swollen. Also, this patient will have excessive malaise. They are always tired. They have not done anything, or they have not even walked or even done anything that needs a lot of energy, but they'll always tell you that I'm very tired, I cannot even do this and this. This is some of the late signs of prostate cancer. Also, they have excessive weight loss and loss of appetite, because at this point patient is just in a lot of pain and nothing else they can do. If you notice some of these signs and symptoms, either early signs or late signs, it's always good to consider going for investigations. And some of these investigations include urine test. We are doing urine tests mainly also to rule out other conditions, like what I've said, urinary tract infection. You also need to do prostate exam. You also need to do an MRI, and also a doctor can consider doing a prostate biopsy. There is also a blood test, what we call PSA. This is a prostate specific antigen that usually help to identify if there is any signs of prostate cancer. Actually, if you have high levels, it doesn't mean that you have prostate cancer. It can be due to other factors like age, diet, and so many other factors. But it will also help the doctor to consider doing other investigation, and also like MRI, to rule out. You don't just do one investigation and confirm that this patient has this cancer. Actually, we have to do several tests to confirm that actually in this test we did this and it was this way, and like that. Also, you can consider yourself doing a routine test. Routine test is just going for routine tests like yearly or according to doctor's advice. It is always good to know ourselves, to be ready for anything, to be able to educate other people after knowing one of these signs and symptoms, because any cancer is treatable once it is identified earlier, or early diagnosis. But if it is too late, sometimes it becomes a bit hard and challenging for the management team to deal with it. So that's why I advocate for all people to be doing routine checkup of their bodies, not only for prostate but all part of our body. If you see any abnormal changes in your body, it is always good to consider going for investigation. Remember to subscribe to this channel and share with many people, so that many people can get this information and get assistance as early as possible.